Hi, I'm Cherie Rebar.
And I'm Nicole Heimgartner, and it's great to see you all today. Sherry, let's get into some real talk.
All right. The last time that we had Real Talk, we had a lot of topics come up that feed into our performance as nurse educators, as our resilience as nurse educators. And as we know, that ends up influencing our students, their resilience, their ability to care for patients. We wanted to unpack today some things about all of the duties that nurse educators have that may look a little different than it used to in the past and what that's doing to us and then what we can do about that.
Yeah, when we were talking last month, one of the things when we looked back at lots of the questions and things that we kept coming back to was just that overwhelming feeling of that nurse educator role that just continues to grow and to grow and to grow. Like, can you teach one more thing? Can you add this in? Oh, we have these competencies. Oh, we have these concepts. And it's rarely taking stuff out, although we need to because we have too much curriculum, too much content in there. But so many things seem to be growing the role. Sherry and I we've talked openly about a lot of what we do with our students today is just teaching basic communication and things that students 10 years ago maybe came more, and I hesitate to say more equipped with, but equipped in a different way. Uh,
Correct.
and so that is something that, it takes time and helping students adapt to that role of really embracing the art and the science of nursing. And so that's one of the things that kept coming up was all of these things that, be a good nurse and be a good faculty member and do this and do this and do this and do this. And how do you do that and remain resilient and adaptable within the profession? And so that is really kind of the crux of the real talk that we wanted to get to this month and kind of see where it takes us because these conversations, you never know where we're going to go.
I think it's hard enough for experienced educators to be able to pivot to some of these things because many of us that have been teaching for a long time, we're used to going in and kind of hardcore teaching the nursing part. And like you said, Nicole, then we find ourselves in a place where we are teaching more of just how to show up, how to be a good human, how to have the comportment that we think a nurse should have, how to be a professional. And those are going to be topics that we're going to cover too in the future. These all overlap in many different ways. But this is the one we wanted to hone in on because some of the requests from the last Real Talk was how do we just kind of handle this? And one of the biggest things is how do we all get along? Because some of us work with big faculty, and everybody's got an opinion. But even if you work with a very small faculty, how do we make decisions that are in the best interest of the program and the students and not kill ourselves in the process because we keep adding stuff in, like you said. And then what happens is there's all of these competing interests in a curriculum, in expectations that our experienced educators are struggling with, much less our new educators that are coming in. In fact, I know that you and I have seen a lot of discussion boards, or when we've traveled across the country and worked with educators, one of the most common questions they ask about that volume is this normal?
Yeah.
Is this how nurse educators roll? We've always jokingly said, don't ever come to nursing education if you think it's going to be easier than being at the bedside, because it's not. It's just a different way of being and it's different responsibilities. But we do have to confront, is this normal? Because the answer is it wasn't 5 or 10 years ago. And even if it's normal now, we need to make changes so that we have sustenance within our faculty and our students.
Yeah, and I think too, we're going to talk a little bit about generational stuff, that's going to come about. And I think a lot of times we think about generational relationships in terms of meeting the needs of our students that are from different generations. But we don't always think about professional interaction and comportment when we're interacting with faculty of different generations. And
Yeah.
we're really, our profession, nursing education and nursing faculty are really in the crux of that generational mix right
Yeah.
now, just because the average age of nursing faculty is high. So we have a lot of nursing faculty that are aging out, and new faculty, thankfully, are coming in. But it creates a dichotomy, not a bad thing, but it creates another piece to that element of how do we make the program work? And how does everybody get their voice heard? And I
Yeah.
think that's where we have to really start looking at programmatic mentality.
One of the things we need to also talk about is that age of students. We talk about different generations that are in faculty. And in the past, often what we thought of was that at your 4-year baccalaureate programs, that's where all of your 18, 20, 22-year-old students went. And your associate degree programs were where all of the non-traditional, I'm going to call it older students went. That's not how it is anymore.
Yeah.
With funding, especially with the cost of education, many, many students and their families have looked at associate degree programs and said, this is a much better way for us to go. It is a faster way to go. We're able to help our student, or the student themselves says, I can get my degree and then I can go work someplace that may help me if I want to move on in other forms of education. And so we are seeing younger students that are coming into our associate degree programs, and perhaps that goes back to what you said a little bit earlier, Nicole, that maybe a decade or so ago, maybe it wasn't just that the people were more prepared, like we said, or more equipped, but they had a little more life experience.
Yeah,
The students
exactly.
today that are the 18 to 22-year-olds don't have as much life experience, and we don't expect them to, but they've also lived through a phenomenon that many people didn't live through in that age and time, which was COVID. So they're
Exactly.
coming with youth and inexperience, not a lot of life lived, and a couple of years of being locked away and learning online.
Exactly. And they are being, for the most part, educated by faculty who should be teaching in a way that is different from the way that they learned, because
Yes.
we know that lecture is ineffective in terms of really creating long-term retention. But if I look back to my educational experience, it was all lecture. Was yours?
Yeah.
Ex-
Mine too.
That was the
Absolutely.
standard. That's what happened.
And that
But
was college in general.
it was. But
Community
when we
college, 4-year college,
right,
your professor stood there and they lectured to you. Didn't matter what subject it was.
right.
And you
But
took
well,
notes.
you did. But we know now when you know better, you do better. And
Yes.
so we know how the adult brain works, and we know
Yes.
that active learning and all of those pieces that we're working to bring into nursing education are things that help to solidify long-term retention and really ultimately help the student develop cognitive processing that leads to effective clinical judgment. And so that's just another piece of it. But all of these things, when you think again, if we come back to that idea of resilience, all of these things can chip away
Yeah.
at your resilience,
Yeah.
and especially, I mentioned before that programmatic mentality, especially if you're working with a group, maybe where people are at odds with each other, or you're
Right.
trying to come to 100% agreement on everything. Tell me how you
Right.
feel about 100% agreement on everything.
And nobody is ever going to, we can't even agree sometimes on what we're going to order for lunch, much
Exactly.
less anything else that's programmatically very important.
Right.
And that, if we've got resilience, it's being chipped away from experienced faculty who are just tired of
Right.
this. And then
Yeah.
you bring in the poor new faculty that are wondering again, is this normal? Then what we end up doing is making decisions that are not in the best interest of anybody.
Right.
So I think we have to reframe how we operate as a faculty to help programmatically develop some resilience in each person within that to have some as well. And one of the ways that you and I have talked about this is moving to a programmatic mentality. We cannot have singular voices everywhere making decisions or saying that things should be this way because that's how it's always been, or that's how they do it in their course, or I think this is the right way to do things. If we're nurses that use best evidence at the clinical bedside, why are we not nurse educators using the best educational evidence? And one of those things is moving to a programmatic mentality where we look at the evidence before we make decisions
Right.
about anything, whether it's policy, whether it's curriculum, whatever the topic is. And a lot of programs have never really had that conversation. How do we come to a programmatic mentality? And this is where you will see people that have meetings over and over and over, and the agenda items never change
Correct.
because decisions are never made.
Right.
And then they're stuck.
Or even they get deferred. Like, well, doesn't the dean or doesn't the director, the program director, don't they need to make those decisions?
Yeah,
And I think it's really important that faculty as a whole hear um, your voice matters.
yeah,
Your voice matters in the curriculum.
yep,
Your voice matters to your students. Your
yep,
voice matters to the profession. Your voice matters to policy that impacts the profession.
yep,
And so every voice matters.
yep.
And that's a really important piece. And who owns curriculum? When we look at a curriculum within an institution, who owns it?
Everybody.
Right? The
All
fact,
the nursing faculty, not
right?
just the more experienced people, not just leadership. Everybody, every nurse educator does. And Nicole, something you said that I think is so important when we talk about every voice matters. Most nurse educators talk to students about how to speak up if they see something, even if you're a student and you see something that's not right or not safe. And we try to instill that when our students get ready to graduate. When you go out, even though you're a new nurse, it's important that you speak up and things like that. But sometimes we don't tell our new nurse educators that their voice does matter too. And they may not come in with the breadth of knowledge about curriculum or program evaluation or whatever, but showing up, listening, and advocating, if they dig into the evidence also, their voice matters just as much. All of us together are stronger than some of us.
Right. Well, okay, so here I'm going to just throw this out there. Um, so what if I really think that something needs to happen? I really think it needs to happen. The evidence says one thing, but I have academic freedom, as a professor,
Mhm.
and I really think that this needs to happen. Where's the rub there? How do we sort that out?
Well, I think the question I would ask back to you is, do you though? Do you really have academic freedom? What does that mean? And what context are we looking at that in? Because that is a phrase I think that gets pulled around, and there is a place for academic freedom in every academic institution. However, we work in a profession that has to have a unified voice. And we work in a profession, whether we're looking at us as nurses at a bedside or as educators, that has to work with evidence that is there. And we can't make unilateral decisions. Your academic freedom and my academic freedom, those are things that are rooted in the ability to speak freely,
Right.
to be able to discuss things in the classroom that sometimes might be hard to discuss. We have academic freedom to do that. We have academic freedom from institutional censorship when we're speaking or writing. We have freedom from being able to speak and write with our students and helping them grow as citizens. But that doesn't mean we have unilateral authority to just go rogue and make decisions within a course or a couple of courses that affects an entire program.
And that's a really, really, really important piece. And I guess when I work with new faculty, one of the things that I encourage them to do very first day is look before you and look behind you because that's more as important as where you sit. Because if you don't understand the whole curriculum, it's really hard to operate and be effective for the part of the curriculum that you're working with within the course that you're teaching, not your course,
Yeah.
the course that you're teaching.
Yeah.
So look before you and look behind you. What
Right.
came before, what comes after, and how do I bridge the gap in between? And a
Yeah.
lot
How
of
does
that,
that fit?
yeah, and a lot of
Because
that
you're not
relies,
isolate.
it's not, and it relies on trusting faculty
Yeah.
that came before you and trusting faculty that come after you because you can't teach the whole curriculum, right?
Nope. Nope.
Everybody's got to work together. And so I think those are, those are a really important piece to think about, especially for our newer educators that are trying to figure out
Yeah.
their way and how to have a voice And, I'd give the same encouragement to our seasoned educators, like
Experienced.
experience, because a lot of times what I tell myself when there are new faculty sitting at the table is I tell myself to be quiet, listen to new voices because
Yeah.
they bring good ideas, new ideas. And that doesn't devalue the history of things
Nope.
that may have been done,
Nope.
but it allows time for new voices to be heard and
Yeah.
that to be combined with the wisdom that comes
Right.
with
And experience.
an experience of progressing along that novice to expert um,
Continuum.
continuum. There we go. That's the word
Yeah.
I'm looking for.
Yeah,
So,
I think one of the quickest ways to squash people when they are new, whether they're new, and I'm talking new to nursing education, doesn't matter their age. They may be brand new to nursing education. They've been a nurse forever. One of the quickest ways to squash them is to devalue their input. Oh,
exactly.
well, we've done that before and that doesn't work, or anything like that's the way we've always done it. So that's why we need to keep doing it. And then what that does is it drives those new voices backwards because first they feel devalued. Second of all, they feel discouraged to speak up. They don't want to be embarrassed. And often, as we all have a tendency to do, we think we're wrong because, oh, well, they're much more experienced, so they must know.
Yeah.
There's got to be that blend between that. And, I think that is something that every nurse educator can get on board with because if we realize, we just talked about what academic freedom is, if we realize that in a practice based profession and curriculum, what it's not is it is not a license to do our own thing and
Yeah.
to accomplish whatever we individually think is best. It is not exemption from those requirements of state boards of nursing or accreditation or professional standards or other educational models. It is not immunity from being accountable. We're still accountable to boom. We are accountable to a whole curriculum, which is what you said about looking what was taught before, what's being taught after, or even if you're on the very front end, what am I teaching as a foundation to build on? Or at the very end, what has been taught? How can I help launch them to practice? We are accountable for an entire curriculum. And
Exactly.
when we work together, evidence shows that our ability to work well, to enjoy, and therefore to have some resilience is increased. When we do those things like we're just in it for ourselves, that's the way we've always done it. We don't want to hear the new voices. I'm going to do with my course what I want to do because I know best. That's where we really go the wrong direction and we
Right.
hurt ourselves. We hurt our curriculum and our students.
And the other thing that I think can be a real zapper to resilience, something that I guess I'd challenge all educators to think about as well, is not every hill is one to die on.
Oh gosh, preach
I
that.
I got a handful, like, and when I say handful, I mean like just a few
There's
things.
like
Like
three.
there's like three or four that I'm like, all right, this
Yeah.
is the line in the sand here.
Yeah.
But a lot of times, and especially, we work with a lot of faculty groups, a lot of times it's over literally a verb. Like people
Right.
are ready to come unglued over a verb.
In a course outcome.
Right. At the end of the day, you got to kind of step back from it and look and say, okay, is this the hill? If this is going to help us move forward and evidence is there to support what you're doing, but you've got feelings this way or that way, is this the hill? Now, there are some things that you got to
Right.
make the hill, but not all
But
of
there's
them.
also things that you can live with.
Exactly.
And
And
like
that's
that
where that
verb thing, as
contentment.
long as it still has the right intention, I'm not going to die on that hill and prolong that discussion. Those are the things that we end up spinning our wheels on and we never get to the important stuff. And
Exactly.
nurse educators can wordsmith a lot of stuff,
Yeah, we're
but
good at
that's
that.
where it comes back to what can I live with that does not fundamentally compromise the curriculum or student outcomes versus what can we move forward with so we do have consensus. The majority support this, and if I'm the outlier, I can at least live with that.
Right.
And then we can move on because then we get somewhere with making decisions. Otherwise, we just sit there.
Right. I think all of those are tools that we can use, to promote our own resilience. And when we have a faculty group that we can talk openly with about our courses, about our exams, and not have the fear of, oh, they're going to judge me or they're going to say things about me, that type of thing, but to have truly that openness and professionalism. I think it also helps just to have that openness about what's going on in the world today and how students are responding to that, and to be able to have those discussions together so that we're equipped when we interact with our students as well, so that we can bring evidence and professionalism and help not only promote our own resilience, but help our students promote and develop resilience from the very beginning.
Yeah, and I think this is a place that we can say that we can wrap this up today because this is a bow and a package that just keeps on giving. It's the
Absolutely.
gift that keeps on giving, but everybody has a voice within that. And you know what? Even if you work in a faculty body that I'm going to use the word is fractured, all it takes are two or three to start role modeling that accountability with each other, that collegialism, that professionalism, and that resilience to make little inroads. You
Yep,
and I have had that experience, and it took a
absolutely.
little time, but culture change can come.
You can.
We just have to be not afraid to speak up and to live that truth of being a nurse and a nurse educator that's grounded in values and grounded in evidence. So, anyway, that is still an open ended conversation, but that's enough real talk for today. So, we'll look forward to talking the next time.